scanning the room.
Hello, my name is Sarah New and I am a PN student at Wilson State College. And today I'm going to be demonstrating how to irrigate a wound, how to obtain a wound culture, and how to change a wet to dry dressing. So we're in the supply area. I have received my doctor's orders. So before I do anything, I'm just going to review them real quick. So our patient is Shirley Coast, date of birth 5/14/64. Dr. Leo has ordered the daily dressing of wound with a wet to dry dressing and to change dressing as needed. So he's also ordered us to obtain a specimen for wound culture, and I know that that also requires the wound to be irrigated before I can obtain the culture. So I'm going to need to get those supplies. All right, so that's done. Before I get anything, I'm just going to go ahead and perform hand hygiene. Okay, so I need my normal saline for my irrigant. I'm going to need some sponges for that, some 4x4 gauze. I need a 30 ml syringe, and also our catheter, which our angiocath. So normally this would be in a wrapped container, but for video purposes, it is not. We have our dressing tray, and we know that this is not expired. It has not been opened. I'm going to need to measure the wound, so I'm going to have my measuring tape. Here's my culturette along with my label, and it does have all the correct identifiers on it. I'll need to add initial location, time, and date to that when I send it to lab. All right, so we have our tape, our emesis basin, and then our biohazard bag for our culturette. Okay. Just gonna set those there, pretending those orders are not there. All right, so normally I would pack all this up in my basin, take it to the patient's room, but for video purposes, we're just gonna kind of leave it set up on the table. All right, so now I'm gonna go into the patient's room. So knock, knock, provide privacy. Hi Shirley, my name is Sarah. I'm gonna be your nurse today. So Dr. Leo has ordered us to change your dressing and to also get a little wound culture. Can you go ahead and tell me your name and date of birth, please? Shirley Coast, 5/14/64 is what she tells me. Okay, thank you. And I just need to check your armband, and it says the same thing. Do you have any other allergies besides the codeine? You do not, okay? Are you in any pain today? Just a little bit? Okay, so you're at, like, on that scale of 1 to 10, where are you at on that scale? You're at a 4, and where would you like it to be? You want it to be at a 4, so you're okay. Okay, so if my patient was in any pain, I would want to go ahead and medicate them and wait for 30 minutes for that medicine to kick in before obtaining any kind of wound culture, because it can be a little uncomfortable. All right, Shirley, so we're gonna get you rolled over so I can get that dressing changed, okay? Do you mind if I pull this down a little bit? All right, so we're gonna pull that down. All right, so we're gonna roll over on 3, 1, 2, 3. Okay, we just wanna expose the area that we're working with for modesty. All right, so I'm gonna come over here and get everything ready before I pull that bandage off. Okay, so we have our waterproof chucks. I'll put one under here. I'm gonna put one more on that bedding. Okay, so we have our biohazard bag. Set that within reach. Okay, then we need to place our emesis basin. Okay, so Shirley, I'm gonna go ahead and take this bandage off now. If this tape was really stuck on there, we'd have to use some alcohol prep pads to help pull that off. So just being careful not to pull on the skin. Okay. All right, so we're gonna go ahead and take our gloves off. All right, so I'm gonna wash my hands, change my gloves. I need to assess this wound bed for color, drainage, if there's any odor. All right, so it looks pretty red. I see some yellow pus, so I will document all of that. And I'm also gonna just lightly tap around and assess for any tenderness. And I would also document the location of that tenderness and how severe it was. Okay. Gloves are sticky. Okay. All right, Shirley, so I'm just gonna pressure on this wound. You tell me where it hurts. Okay, so about right here. All right, so Shirley has indicated that she is feeling pain in the inferior 6 o'clock region. So we'll go ahead and document that also. All right, so we need to go ahead and irrigate that. All right, so we would get our bandage out of the way of our dressing. We're gonna go ahead and get our catheter ready. Add our angiocath. All right, so we would draw out the 30 mils of normal saline, and again, just double checking that that is normal saline. All right, so when you irrigate, you want to go from top to bottom, side to side. Okay, so we're just going top to bottom, side to side. And we would continue this until the drainage running out of it was clear. Okay, so we would go ahead and dispose of that. And our emesis was clear, our drainage was clear, so we can go ahead and get rid of our emesis basin. All right, so I'm going to change my gloves. All right, so now we need to get our wound culture. Hands are sticky today. All right, so we've got our label ready. Culture ready. Okay, Shirley, so now I need to go ahead and get that specimen from the wound just to check for any infection. So basically you're gonna feel me just press a little bit inside the wound. It might be a little uncomfortable, but it won't last long. All right, so we're gonna go ahead and get our culture. This is not expired, it has not been opened. Break the sterile cap, check the date, it's good. All right, so when you obtain your culture, you want to go inside the tissue that's reforming. So you don't want to get on any of the sloughing or any of the eschar. So we're going to go right here and we're just going to swirl, pressing slightly, and you also want to avoid the edges of the wound. All right, so we'll go ahead and put that in, avoiding the edges of the culturette. We would add our label, adding label. And then we would go ahead and put it in the biohazard bag. I would make sure that this label has the time, the location, the date, and my initials. All right, so that's going off to lab. All right, so now we're gonna go ahead and put a fresh dressing on here. So we need to add our normal saline to our dressing tray. All right, so we wanna squeeze out the packing, and this is our fluffed packing. And also before, when I was irrigating, I would have dried the area around it, but not the wound itself. So I did forget to do that. So we're gonna go right in the center. We wanna avoid the edges. And just add your packing, again, avoiding the edges. Okay, so we go ahead and grab our other 4x4. I'm gonna squeeze out the excess moisture. Add that right over top of our packing. And just hold that there gently. We want to add our abdominal pad. Make sure that blue line is out. Okay. We're going to add our tape. put my initials and the date and the time on that. Okay, so that's good. All right, so Shirley, we're gonna go ahead and get this area all cleaned up. How are you feeling? Was that okay? All right, so when I get all this cleaned up, I would doff my gloves, document everything that I observed as far as the characteristics of the wound. Real quick, I need to go ahead and measure. So I need to document that as well. So before I put that on, I would have measured. I did forget to do that, but I would definitely make sure and measure the length, the width, and the depth. In this case, there was no tunneling, so we would not have to measure the depth. So I would document all of that. If there was any drainage, the color, the odor, how Shirley was able to tolerate it. You want to dispose of your contaminated irrigant. And place this all in a larger biohazard bag. All right, Shirley, let's get you rolled over. 1, 2, 3. Okay. All righty. You feeling okay? Shirley's feeling okay. So I'll make sure she has her call light within reach and make sure I perform a hand hygiene before exiting the room. And that should be it.